So the clinical is Coxa Valga. Valga is a Latin word. It means exceeding of anything. Okay. Basically, in this clinical, the angle between shaft of the femur and the neck of the femur is exceeded. Okay. So as you can see in diagram, we have a Coxa Valga. The angle is exceeded from 135 degrees. The normal angle is 125 to 135 degrees. Okay. So in Coxa Valga, the angle between the femoral neck and the femoral shaft is exceeded. Because of this exceeded angle, the femoral neck becomes a straighted. Okay, as you can see in pic, here we have a Coxa Valga. The angle is exceeded and the femoral neck become straighted. Okay, because of this straightedness, the flexion becomes worsen, and the abduction movement of the femur becomes better. It is better because of this straighted angle. When the angle is exceeded, the femoral neck becomes um, straighted. Okay, because of this straighted, the abduction movement will be a good in accommodation. Okay, it means that its movement is better, but the lateral rotation of the femur is limited. Okay, so the lateral rotation of the femur is limited. The treatment of the Coxa Valga is osteotomy. Okay, that was our Coxa Valga. Now we will discuss about the Coxa Vara. In Coxa Vara, Vara is a Latin word. Another Latin word means reduction or the decline. So in this, the Coxa Vara, there will be a reduction of angle or the declination of the angle between the femoral neck to the femoral shaft. Okay, so in Coxavara, the angle will be decreased or the declined from the 125 degrees. Okay, or the we can say the 135 degrees when the angle between the femoral neck to the femoral shaft is declined. Okay, because of this declination, there will be a better flexion movements. Okay, but worsen abduction movements, good lateral movements. Okay, so the femoral neck becomes more horizontal rather than to be a straighted. Okay, the treatment of the Coxavara is a physiotherapy. Okay, here you can see in pic we have a Coxa Valga and the CoxaVara. In a normal condition, when the angle is normal, the knee joint is a clearly stabilized form. But in the Coxa Valga, when we have a excision of angle, the when the femoral neck becomes more straighted, there will be a genu verum. Genu verum means bow's leg. Okay, the Coxa Vara leads to the Genu Valgum. Genu Valgum means knock knees because of the uh, angle between the femoral neck and the femoral shaft is reduced and declined. Because of this declination, it leads to the inward movement of the knees, that is known as knock knees. Differentiate in a tabulated form the Coxa Vara and the Coxa Valga. So the first point is angle between femoral neck to the femoral shaft exceeds 135 degrees. As we can discuss about the normal angle between the femoral neck to the femoral shaft is 135 degrees. It ranges from 125 to 135 degrees. In Coxa Valga, it exceeds 135 degrees, and in Coxa Vara, the angle between femoral neck to the femoral shaft declined 135 degrees. Okay, and now we will discuss about the movements that differentiates between two clinicals. Okay, so the first thing is in a Coxa there will be a worsen flexion but better flexion in Coxa. The next one is a better abduction, and in Coxa there will be a worsen abduction. Okay, there will be a limited lateral movements, but in Coxa there will be a good lateral movements because of declination of the angle. And remember one thing, the Coxa Vara, due to declination of the angle, it leads to the knock knees because of inward movement of the knees. And in Valga, we have a straighted femoral neck that leads to the straighted conformation of the knees, known as bow legs, or we can say it Janu Valga. Okay, so femoral neck becomes straighted in Coxa Valga, and Coxa Vara femoral neck becomes horizontal. Okay, so the treatment is osteotomy, and in Coxa Vara there will be a physiotherapy.